Okay, so we are talking about spirituality, mental health, and psychiatry interdependence. Okay, psychology interdependence. These patients, mental health, spirituality, psychology, mental health interdependence is extremely important. You cannot ignore spirituality in terms of psychology. I call it psychospiritual medicine. I defined this in 1996, 1997. It is extremely important. Okay, you cannot ignore it. So as a mental health practitioner, a lot of times, you know, as a physician, we are mental health practitioners, beside the fact that I've always been studying mental health since I remember. Okay, so the point of it is that you will be surprised how many patients who are suffering from depression or any kind of mental health condition, in fact the root of their condition is in spirituality. Why? Because a lot of people, since the day they're born, the root of their existence is in spirituality and spiritual upbringing. Okay, so as these, especially with the and reward guilt and reward system that we have in spirituality. If you do this, you go to hell. If you do this, you go to heaven. If you do this, you get punished by God. If you do this, you get rewarded by God. So if you do this, you're a good person. If you do this, you're a bad person. So imagine a child, at the very young age is learning these things. And now, as they get older, oh, I did this, I'm a bad person. Oh, I did this, I'm a good person. Well, of course, they're going to become depressed if they did something horrible, right? They get, they start blaming themselves, some self-blame, self-talk. Oh, I'm a bad person. How could I have done this? Oh, blah, 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 blah. So self-beating, right? Subconsciously. Sometimes they're not even aware of it. So like they're all beating themselves up subconsciously. They're not aware of it. Now they're depressed, blah, blah, blah. And now, you just give them Prozac. How the heck are you going to treat this person with Prozac? Mentally, the person is beating themselves up like 25 hours, 24 hours a day. You're trying to treat them with 20 milligrams of Prozac? How? How do you expect that to go away? It's not going to go away. Person can't sleep. You just go, okay, take this and maybe you can go to sleep. No, you can't go to sleep. Patient is anxious because of it, because of all these mental, anguish that they have. Okay, maybe, why is this person not able to, relax? Well, because, okay, so there's so much in-depth spiritual interaction with mental health. But if you don't understand that interaction and in-depth, causation, how are you going to address it? And if you just got this blind spot as a mental health practitioner and you ignore it, you're never going to be able to address it. That's why psychospiritual medicine is the treatment, not just blind spot mental health. Practice, like psychology, ignoring, spirituality. Forget about it. Okay, there's no way. You have to do psychospiritual medicine. It is just the way it is. You want to ignore it? Do it. Okay, you're just a lousy practitioner in my eyes. Okay, just blind spot. Just go through, medicine like that. Spirituality doesn't exist. Okay, if you say so. It does exist. Why? Because people made it up anyway, whatever. Or it does exist, or what, I don't know. But in our culture, since whenever it was created, it's been in practice. So people now have come to agree in their own minds that, okay, if you do bad, you go to hell. If you do good, you go to heaven. If you do this, you're a good person. If you do that, so then it exists, because in their consciousness, it exists. And it's in subconscious, it exists. So then it exists. Okay? So then spirituality exists. Does that make sense? You understand what I'm saying here? It doesn't matter if you, as a practitioner or as a scientist or whatever, believe it or not. This is not about just science. This is about the fact that anecdotally, in practice, it exists. So practically, it exists because it affects the patient's psyche. Does that make sense?